welcome to sir.
अतः क्रियाकल्पं व्याख्यास्यामः यथोवाचोक्तान्तरैः. This chapter deals with the therapeutic protocols used for the eye disorders. Now, the therapeutic protocols mentioned in Sushruta are Tarpada, Putapaka, Seka, Ashtotana, Anjana. The chapter starts with the Sarvashastrartha Tattvajnana Tapo Drusti Udaradhihi Vaishwamitram Shashasa Atha Shishyam Kashipati Munihi. It starts with the usual reference about the teacher and the student relationship. The teacher teaches the student about the chapter there. Tarpadam Putapakascha Sekaha Ashtotana Anjane Tatra Tatra Upadishtani Tesham Vyasam Nibodhame. The protocols are Tarpada, Putapaka, Seka, Ashtotana, Anjana, and their details are described as such. Now, the Tarpada, Samshuddha Deha Shirasaha, Dirnanasya Shubhe Dine, Purvahne, Aparahne va, Karyam Akshnostu Tarpadam, Vatata Paradohine, Veshmani Uttana Shayinaha, Adharo Mashachurnena, Klinena Parimandalo, Samo, Dradho, Asambadho, Kartavyo, Netrakoshayoham, पूरयेत् घृतमण्डस्य विलीनस्य सुखोदके आपक्ष्म अग्रात् ततः स्थाप्यं पञ्चवाक्षतानि तु स्वस्थे कफे 6 पित्ते 8 10 वाते तदुत्तमं रोगस्थानविशेषेण केचित् कालं प्रत्यक्षते यथाक्रम उपदिष्टेषु 3 1 5 7 च 10 च दृष्ट्याम् अथ 8 च वाक्षतानि विभावयेत् ततश्च अपाङ्गतस्नेहं श्रावयित्वा अक्षिशोधयेत् स्विन्नेन यवपिष्टेन स्नेहवीर्येरितं ततः यथा स्वं धूमपानेन कफं मस्य विशोधयेत्. Now the protocol of the tarpana is before the tarpana is done, the patient has to be given shodhana chikitsa like vamana virechana or shiro virechana also, and then on a auspicious day after the food is digested, either in the morning or in the afternoon, tarpana has to be done. The area where the tarpana has to be done should be properly ventilated, and there should not be a direct exposure of the sunlight or even the dust as such. Patient has to lie down in a supine position, and then you have to have a border created around the eyes with the mashachurna, the floor of the black gram. And then the around the area a strong support has to be placed over there, and it should not hurt the eyes. It should be away from the eyeball as such, around the orbits. Then it has to be filled with, that area has to be filled with the ghritamanda, the clear portion of the ghee, which is dissolved in warm water, with the warm water, or which is just warmed as such, till the level of the eyebrows, so that the whole of the sclera would be covered with that. And then you have to keep it for vakshata, that's 100 matra kalas in multiplication. For in a healthy person, it's a 500 matra kala. In kapaja vyadhi, 600 matra kala. Pittaja vyadhi, 800 matra kala. And vataja vyadhi, 1000 matra kala. Or the duration of keeping that ghee also can vary according to the location of the lesion, like the 300, 500, 700 and 1000, depending upon the location of the lesion, like Sandhigata, Patalagata, Pakshmagata and so on. And then once this time duration is over, that border created by the floor has to be opened, and the ghee has to be drained out on the lateral portion as such. And then after that the patient has to be given a dhumapana. As far as the time duration of the tarpana is concerned, and there is a slight variation between the different samhitas. As per the Vagbhata, Pitta Pradhana Vyadhi, it's 600, the rest of, and Kapha Pradhana 500, whereas Sushruta, it's a 500 matra kala, Kapha Pradhana 600 Matrakala, Pitta Pradhana 800 Matrakala. Or Sharmadara Samhita, the time duration is 500, 500, 600 and 1000. Bhava Prakasha mentions the healthy Kapha Pradhana. In Pitta Pradhana, there is no reference of the Tarpana according to Bhava Prakasha. So there is a slight difference. Similarly, according to the Adhisthana, Sthana, Sushruta, it would be Sandhigata 300, Vatmagata 100, Shuklagata 500, Krishnagata 700, Drishtigata 800 or 1000, Sarvagata 1000. Whereas in Ashtangadaya, the duration according to the location would be Sandhigata, it's almost same as that of Sushruta. Sharmadara, there is a slight variation. Sandhigata is 500 Matra Kala, Vatmagata 100 Matra Kala, Shuklagata of course 600, and the rest of the things are similar. So there is a slight difference of opinion between various authors about the duration during which the ghee has to be kept over. Otherwise the protocol is the same. Now it has to be repeated if necessary. Ekaham va treham vapi panjaham cheshyate param. Either it can be given for 1 day or 3 days or 5 days maximum. Within that period, we have to have the proper clinical outcome. Tarpane triptilingani netasya iman lakshayeta sukha swapna avabodhatvam vaishatyam varnapatavam nivrittihi vyatividhamsaha kriya laghavamevcha. The signs of proper tarpana are there should be sukha swapna avabodhatva. The patient should be able to sleep as well as wake up with ease, with comfort. And there should be clarity of the vision, color of the eyeballs also should be normal, and whatever the disease which is targeted should be clear as such. This would be the signs of a proper tarpana drug. Guru aviram atisnigdham ashva kandupadevat jneyam dosha samutklishtam netram atyarthadarpidam. Excess of the tarpana can produce a heaviness in the eye, and the whole eye area color could be disturbed, or color could be somewhat altered as such. Avilam, that's altered color. Atisnigdham, there could be more moisture left over, as well as there could be more of tears, itching, or even swelling around the area can occur due to Atiyoga. Then Alpa Yoga or Hina Yoga, Ruksham, Abilam, Asradhyam, Asaham, Rupadarshane, Vyati Brigdishya Tadnyayam, Hinadarpidam Makshija. The Ruksha, there could be more dryness, and again the color could be altered, and Asradhyam, there could be even reddish discoloration, or even blood also may be seen. Asaham Rupadarshane, patient would not be able to tolerate this light, or cannot see properly. Vyadhi Vriddhi, the disease could be enhanced. These are the signs of Hina Tarpana. Anevaha dosha bahulyata prayata chikisate dhumanasya anjanai sekaihi rukshaihi snigdheshta yogavita. These conditions have to be treated by dhuma, nasya, anjana, or ruksha or snigdha sneham, riseka, according to the condition. Tamyati ati vishushkam yadruksham yacha atidaranam shirna pakshmavilam jihmam ro tvistam yadbhusham tadakshi tarpanam deva labheta urjam asamshayam. Any patient who is having a gradually deteriorating vision, or eyes which are very dry or dry eye conditions, or the patient who has severe pain over the area, or a patient who has impaired eyebrows or altered eyebrows, or maybe the brow hairs are lost, or if there is a deviation like ptosis or such condition, or blepharitis like conditions, in such conditions Akshitarpana would be producing the normal results, or it will clear the disease. Then it should not be done, Tarpana should not be done in Durdina, Atyushna Shiteshu, Chinta Ayasa Brahmeshu cha, Ashanta Upadravya Chakshni, Tarpanam na prashasyate. If in the cloudy days, or very warm or very cold days, and when the patient is suffering due to some psychological illness, or due to strain, or has a giddiness, or if the complications of the eyeball, this eye treatment has worsen. In such conditions, tarpana should not be done. पुटपाकः तथा एतेषु नस्यम् एषु च गर्हितं तर्पणार्हाः नये प्रोक्ताः अक्षमाश्चये. Putapaka can be another alternative choice, and in those conditions Putapaka is contraindicated, or in those conditions where the Nasya is contraindicated, the Tarpana should not be done, or even in the patients who are not capable of taking the Snehapana, Tarpana should not be done. Now the next protocol is Putapaka. Tatah Prashanta Dosheshu Putapaka Kshemeshcha Putapakah Prayuktavyaha Netreshu Bhishya Bhavetam Snehano Lekhaniyashcha Ropaniyashcha Satridha. Now Putapaka is just a modification of the Tarpana. The difference is that in the Tarpana it's only the ghee with the warm water has applied. In Putapaka you will be applying many of the medicines which could be either in the form of a swarasa or kashaya. Liquid medicines are poured. Otherwise the protocol is similar, where you keep a boundary, form a boundary with the floor, and then pour the liquid over that. And based upon the outcome, it could be categorized into Snehana, Lekhana and Ropana. And it should be done after again the similar protocol, like the Shodhana has to be done, and the patients who have indication for Putapaka and who can tolerate the Putapaka has to be given. Hitaha snigdho atirukshasya snigdhasyapita lekanaha dusteh balartham aparaha piktasraga vranavartanata. Now the indications are when the patient who has a atiruksha, more dry conditions, snigdha Putapaka is to be done. If the patient has more of moisture and discharges, the lekhana has to be applied, and drushteh balartham, to improve the conditions of the vision, ropana Putapaka, and particularly those who have raktapitta and wounds or ulcers over there, the ropana Putapaka is indicated. Sneha, Mamsa, Vasa, Madhya, Medah, Swag, Aushadhi, Kritaha, Sneha Putapakastu, Gharyo, Dve, Vakshate to Saha. Snehana Putapaka is prepared with the Sneha Dravyas, oils, Mamsa Vasa, the extract from the flesh as such, Madhya, Medah, or any of other these oily preparations like Madhya and Medah, and Swagdoshada. Madhura Rasa Aushadhis are used for Snehana Putapaka, and it has to be retained there for 200 matra kalas. Jangalanam Yakrat Mansehi Lekhana Drabya Samudrehi Krishna Loha Rajas Tamra Shankha Viduma Sindhujehi Samudra Pena Kasisa Srotoja Dadhimastubihi Lekhano Vakshatam Dasya Param Dharanam Chede. Lekhana Putapaka is prepared out of Jangala Yakrat Mamsarasa, the extract of the liver of Jangala plant animals, or with any other Lekhana Drabya like Krishna Loha, that's the iron ore, or Tamra, copper, or Shankha, the shells, sea shells, Vidrum, the coral. These are Samudrapena, that seashells as such, again different sorts of seashells, Kasisa, or Shirajito, Dadhi, the curds, or Mastu, the wave water, any of these which are Lekhana Dravyas, they are used for the Lekhana Putapaka, and it has to be retained for 100 matra kalas. Stanya Jangala Madhu Adya Tikta Dravya Vivachitaha Lekhana Trigunam Dharyaha Putapakastu Ropanam. Ropana Putapaka is prepared with the breast milk or Jangala Madhu, the honey from the Jangala Desha, or Adya, ghee, or Tikta Dravya, any of these bitter dravyas are processed with this madhu or adya, processed with the tikta dravya. It has to be used, and it has to be kept there for 300 matra kalas, 3 times that of the ropana putapaka. Bikare 300 matra kalas is the time duration. Bikare tarpanoktam tu dhumam hitvat ropanam sneha svedo dvayoho karyo nayocha ropanam. Then the dhumapana has to be done in case of the Lekhana Putapaka and Snehana Putapaka, but in Ropana Putapaka it's not indicated. Then Ekaham Dviham Vapi Treham Vapi Avacharanam. Putapaka can be done for 1 day, 2 days or 3 days. Yantra Kriyakalpa Jugunam Kalamishade. The restrictions about the vision and the physical activities would be double the time taken for the Putapaka. Like if the patient is given Putapaka for 1 day, for next 2 days he has to avoid seeing bright objects and so on. That control has to be maintained. And that control is a Tejansi, Anilam, Akasham, Ablasham, Bhasvaranita, Na Ikshet, Tarpite, Netre, Putapaka Kudeta. After the Tarpana or Putapaka, during that restriction period, patient should not see bright objects or should not expose to the direct air or direct breeze, should not see at the sky or should not see the mirror or any other shining object should not be seen. Mithyapacharat anayoham yovyadhi upajayate anjana aschodana swedehi ythaswam tamuvachareta. If the patient doesn't follow the restrictions and then any complications have occurred, those complications have to be treated with the anjana, aschotana or swedana, depending upon the presentation. Prasanna varnam vishadam vatatapasaham laghum sukha swapna bodhi akshi putapaka gunanvitam. If the putapaka is done properly, it results in a pleasant color and a clarity of the vision and a tolerance for exposure to the sunlight or these irritant objects, and the patient would have a comfortable sleep and comfortable waking up. That would be a sign of a proper Putapaka. Atiyogata, if there is excess of Putapaka done, then Shopaha, Pitakaha, Timirodgamaham. Pakwe Ashru Harshanam Chapi, Shine Doshodgamastada. In the Atiyoga, there could be swelling over there, or there could be eruptions over the area, or it also can result in Timira, that is, the cataract could be precipitated. Then, in the Hina dosha, now if there is a Hina yoga, either there could be Ashrupaka, there could be suppurative changes, or Harshanam, tingling sensation around the eyes, or any other doshodgamaha, abnormal dosha can occur. Ata Utam Prashami Putapaka Prasadhanam, the how to prepare the Putapaka, that process is mentioned. The do bilu matra structurasya pindavu mansasya peshitam द्रव्याणां बिल्वमात्रं तु द्रवाणां कुडवोमुतः तदा एकध्यं समालोक्य प्रत्यैः सुपरिवेष्टितं काश्मीरी कुमुद एरण्ड पद्मिनी कदली भुवैः मृदौ आलिप्तम् अङ्गारे खाद्रैः अवकूलयेत् कटक अश्मन्तक एरण्ड पाटला वृषभादरैः सक्षीरधूमकाष्ठैर्वा गोमयैर्वापि युक्तितः स्विन्नम् उद्धृत्य निष्पीड्य रसम् आदाय तं नृणां तर्पणोक्तेन विधिना यथावद् अवचारयेत् खनीलके निषेच्य स्यात् नित्यम् उत्तानशायिनः रक्ते पित्ते च तौ शीतौ कोष्णौ वातकपापहो. The preparation of the Putapaka content is by taking the flesh of animals, that is mamsa, of 2 bilumatra, of size of 2 bilupara, and any other drugs which are added would be half of that, Trivyanam bilumatra, other bilumatra have to be added, and 1 kudava of the liquid, that's around 400 ml of the liquid has to be added to that, and all of them they should be prepared into a paste and then covered with the leaves of different plants like Kashmiri Kumuda Eranda or Kataka Ashmantaka Eranda Patala. Any of these leaves have to be used for covering, and that ball created by that paste and the leaf has to be again covered with the either gomaya or maybe the soil, and this has to be kept in a flame or kept over the heated coal, and you have to process it, and once it becomes cooked like or heated, then the juice has to be extracted out. Putapaka vidhana is mentioned in Bhaishajya preparation. In any other medicines also Putapaka is done in the same manner, where it has to be, the word Putapaka comes because the medicine is covered with some heat resistant object like initially leaf and then the soil or gomaya, and then it is heated so that it's heated in an anaerobic environment. That's the idea of Puttapaka. Then that juice is extracted out, and that same juice has to be used as in case of tarpana. You have to pour the liquid over there. So, and the other difference is in the tarpana, Sushruta suggests that the draining has to be done on the lateral angle, apanga, whereas in the Puttapaka it has to be expelled out from the kaninaka, the medial side. That's all the difference. Rest of the things are same. अत्युष्ण तीक्ष्णौ सततं दाहपाककरौ स्मृतौ अप्लुतौ शीतलौ चाश्रु स्तंभकरौ कर्षकारकौ अतिमात्रौ कषायत्व संकोच स्फुरणावहौ हीन प्रमाणौ दोषाणाम् उत्क्लेश जननौ भृशम्. If the contents we are pouring are either ati ushna, very hot, or tikshna guna, then they produce burning sensation or even paka. Then apluto shitalo, if it's very cold and it's not properly heated or not processed properly, then it can produce ashrustamba, blockade of the tears, and ruk gharshakaraka, pain, as well as there could be friction induced injuries. If the quantity is more, atimatra kashayatvat, if there is a more kashaya rasa, then it can produce a constriction as well as a tingling sensation around the area. If the quantity of the drugs added is less than optimum, then it can produce a doshotklesh, aggravation of the dosha or the initiation of the dosha conditions. Yuktau krutau daha shopa ruggarshat savarashanau kandupadeha dushika rakta raji vinashanam tasmat variharan doshanam vidadyat tau sukhavaham. The Puttapaka drugs have to be prepared properly. If it is not prepared properly, then they may produce burning sensation, swelling, pain, friction over the area. If they are prepared properly, then they would relieve these symptoms. And if it is not done properly, it can produce itching, swelling over the area, and any other disease could be initiated. The whole eyeball may become reddish, and the vision could be impaired if it is not done properly. Vyapadashyatha dosham nasya dhumanjanihi deyata. If such complications have occurred, they have to be treated with the nasya, dhuma or ranjana according to the doshas. Arjantiyoscha anayoho swedaha ushnambutelikaha tata hito avasanecha dhuma shleshma samuchitam. In the beginning and end of this process, like Tarpada and Puttapaka, in both the conditions, a mild svedana with warm water dipped in cloth. Ushnambu Chelika. Chelika is a cloth. Ushnambu, warm water dipped in cloth has to be used for the svedana of the eyeball, and it's also used for clearing. And it also, at the end of that, dhumapana has to be given. Yatha doshopayuktam chanati prabalam vojasa rogam ashyotanam hanti sekastu balavattaram. Ashyotana and seka. Ashyotana is simply pouring of a liquid in the form of drops, a few lesser quantity. Seka is where you pour the liquid in relatively larger quantities in a closed eye conditions. When the eyeball has to be closed and then it has to be poured over the area. And it has to be given in the depending upon the doshas. And Seka is considered to be balavattaram, more powerful than the Ashyotana. Tau tridhiva upayudyata rogeshu Puttapakavata. They also have to be used in the as in case of the Puttapaka, that's snehana, lekhana and ropana. Lekhane saptacha asto va bindava snehike dasha ashyotane prayuktavya dvadashaiva rupane. In the Ashyotana and Seka, there is no need of having a border and keeping the drug for a longer duration. The drops are poured in, it's eye drops poured in, and then it has to be clear. In the Lekhana, as such, either 7 or 8 drops are to be poured in. In the Snehika, 10 drops are to be poured in Ashyotana. And for Ropana, 12 drops are to be poured in. Sekasya Digunaha, Kalat Puttapakat Paramataha. In the Seka, you give a larger quantity of the drug, and it has to be continued for twice the time of Puttapaka. The pouring continuously for a longer duration without the eyeball, without that eyeball restrictions. So there is a continuous lavage. That's the difference. In Tarpada and Putabaka, the drug is kept in contact with the eye for a longer duration without changing it, or there is no continuous flow. A static drug is kept over there. Whereas in Seka and Ashtotana, the drug is poured in an open form and it is drained continuously immediately. In the Ashtotana, the amount of the drug is in form of the drops. In Seka, there is a continuous flow over the area. That's all the difference. Purvane, Aparane, Madhyane, Ruja, Kaleshu, Bhivoho. It can be given in Purvana, in the early morning, or Madhyana, or whenever the patient has severe pain. Yoga, Sneha Seke, Tarpanoktan, Pratakshare. The outcome of the Sneha and Sneha Seka are equal or same as that of the Tarpana. Rogan Shirasi Sambhutan Hatva Ati Prabalan Gudana Karoti Shiraso Basti Ukta Ye Murthadelikaha Shuddha Dehasya Sahayane Etha Vyadhya Shirasya Rudva Sina Se Badnyat Basti Kosham Tato Dridam Yatha Vyadhi Shradasneha Purnam Sanyamya Dharayet Tarpanoktam Dashagunam Yatha Dosham Vidhanam. Another of the option of the treatment is a Shirobasti or Murthadelika. This also is considered Murthadelika. The protocol is after the Shodhana and preferably in the evening, and the patient should have taken the food. The patient is made to sit straight, and then the basti kosha, a bag of leather, has to be applied over the skull and filling that gap with some this floor material, usually suggested by Sushri is masha. Now of course we use the wheat flour, and then the oil is poured over the area. The oil is kept in contact with the skull for a long period. The period of contact would be Tarpanoktam Dashagunam, 10 times more that of the Tarpada Vidhi. It has to be kept there for a duration and then it has to be drained out. Vyaktarupeshu dosheshu suddhakayasya kevale netra eva sthite doshe praptam anjanamachareta lekhanam ropanam chapi prasadanam athapi va. The another of the option is anjana. Anjana is applying a fine paste into the eyelids in small quantities. And those conditions where the doshas are visible and they can be easily drained out, and after the shodhana, and in those conditions where the disease is located only in the eyes, localized conditions, anjana has to be done. And anjana again, lekhana, ropana and prasadana. Lekhana, ropana and prasadana is the cosmetic, the coryllium which is used now, or what we call as eyebrow pencil or eyebrow colors which are applied. Tatra pancharasa vesthana adhyikarasavarditana panchasa lekhanam injata yatha dosham atanditaha. Lekhana anjana is prepared with the rasa dravyas, pancharasa dravyas, other than that of the madhura rasa. Any other rasa could be used depending upon dosha conditions. A substance which is having that taste, rasa, has to be applied in small quantities with a rod or that anjana shalaka. Netra vatma sira kosha srota shrungatika shriram mukhana sakshibhi dosham ojasa sravetu tata. The applied coryllium would be helping in removing the doshas from all the nearby anatomical areas. That sira kosha, that's netra vatma sira kosha, the cysts or maybe the glands of the eyebrow and or Shringataka, the sinuses of the nose, and Mukhanakshakshibhi, from all around, from the nose or maybe the mouth, the discharges would be expelled out, or any of the contents could be expelled out with the anjana, lekhanandra. Then Kashayam Tiktugam Vapi Sasneham Ropanam Madam Tasneha Shaityan Varnyam Syat Drishteshta Balavardhan. Kashaya Rasa Tikta Rasa Pradhana Vidhu Taila Sneha is considered as a Ropadanjana, and it will be helping in improving the color as well as improving the vision. Madhuram Sneha Sampannam Anjanam tu Prasadanam Drishti Dosha Prasadartham Snehanartham Chasaghitam. The Prasadananjana, the cosmetic should be Madhura Dravya with the Sneha, and it has to be prepared and it could be used for Drishti Dosha Prasadartham, improving the vision as well as the Snehana. यथा दोषं प्रयुज्यानि तानि रोगविशारदैः अंजनानि यथोक्तानि प्राह्न साय अह्नरात्रिषु. It can be used in either morning, daytime, or maybe even the night. Depending upon the dosha, the anjana has to be prepared. Gutika, rasa, churnani, vividhani anjanani tu yatha purvam balam tesham shreshtam mahum manishnaha. The anjana drug can be presented in the form of gutika, wicks, or maybe small tablet-like forms, or rasa, liquid, or churna, fine powder. And according to Sushruta, gutika is shrestha, the most valuable, and rasa churna are comparatively less important. Harenu matra vartihi, that varti or wick has to be prepared as in the size of harenu, sasibe, sesame. Sat lekhanasya pramanatah prasadanasya cha adhyartha biguna ropanasya cha rasanjanasya matra tu yatha vartimita mata. Now the size of the varti would be of a size of sesame seed for the lekhana, and for prasadana 1.5 sesame seed size, for ropana 2 sesame seed size, small size as such. Then rasanjana, for the rasanjana it could be any amount of the substance could be used. Ditri chatushalakashta churnasya anpurushaha. If at all you are using churna, fine powder, then the shalaka has to be dipped in that churna either 2 or 3 or 4 times, and that quantity which sticks to that would be used for danjana. Tesham tullagunanyeva vidadyat bhajananyapi savarnam rajanam sharanam tamram vaiduryakamsajam ayasani chayodyani shalakasya yatha kramam. The shalaka or the rod which is used for the anjana, eyebrow pencil, should be prepared out of gold or silver, or maybe horns of animals, copper, or vaidurya, that's the crystals used, or ayasa. The iron also could be used for preparing the shalaka. Vaktayoh mukulakara kalaya parimandala ashtangula tanur madhye sukrita sadhini graha. The shalaka anjana shalaka has to be prepared in the form that the tip should be like mukulakara. It should be like the flowers, tender flowers, like so that means smooth surface, and the diameter should be apu kalaya, lacerous seeds, and it should be 8 angulas in length, and in the middle it should be thin, and it should be prepared in such a way that it can be held properly. Anjana shalaka is mentioned in the Sutrasthana in the Yantra chapter. Audumbari ashmadavapi shariri vahita bhavet. If these metallic rods are not available, it could be udumbara, or it could be ashma, that ashmantaka plant also could be used as it. Vamena akshi vinirbuddhya hastena susamahitaha shalakaya dakshinena kshipet kaninam manjanam apangyam va yatha yogam kuryatyaphi gatagatam vartma upalepit yat angulya eva prejayat akshinatyantyoh anjat badhamanopi vabhishaka. Now the technique of applying the anjana is with the physician with the left hand would be keeping the eyes open and holding the palpebra steadily, and with the shalaka held in right hand, the anjana has to be applied either from the lateral side or from the medial side into the eyebrow, or if it is a very thick, very fine gelatinous substance, it could be applied with the fingers itself. The eyebrows, these anjana can be applied with the fingers also. And it should not be too much, like the quantity of the drug applied should not be too heavy, too much as such. न च अनिर्वान्त दोषे अक्ष्णी धावनं संप्रयुज्येत दोष प्रतिनिवृत्त सन् हन्यात् दृष्टेः बलं तथा. After the anjana, that should be discharged, and the anjana dravya also has to be washed off spontaneously. If it doesn't get spontaneously washed off with the tears, then it has to be cleaned with the dhavana. It has to be washed. Gatadosham apetashru pashyet samyagambasa prakshalya akshi yatha dosham karyam pratyanjanam tatha. After the evacuation of or the removal of all the doshas, the patient has to look at his face in water, and then it has to be cleaned. Then pratyanjana, that's simply cleansing with water, has to be done. Shrama udavarta duritam madhya krodha bayadhvarehi vegaghata shirodoshehi cha artanam neshre anjanam Raga, Ruk, Timira, Astrava, Shula, Sambramba, Sambhavata. Patients who have exerted too much or who have wept in the past, or those who have alcoholics, or those who are very angry, or maybe who have fever and who have fears also, or who have suppressed their vegas or doshas, shirodoshas, headache. In such conditions, anjana has to be avoided because it can produce either reddish discoloration, pain, or timira. Cataract also could be produced, and there could be more of discharges, and so on. निद्राक्षये क्रियाशक्तिं प्रभाते दुग्धलक्ष्यं रजो धूमहते रागस्राव अधिमन्तसंभवम्. If the patient has nidrakshaya, impaired sleep, and in such conditions the outcome could result in kriya ashakti, inability to do the normal activities. If the patient during the anjana there is a direct breeze, then it can affect the vision strength. If there is a smoke or dust at that condition, it can produce reddish discoloration, discharges, or adhimanta also could occur. Samramba shulam nasyante shiroruji shirorujam. If the anjana is applied after the nasya, there could be more of pain and discomfort. Shiroruk, the headache could be more if you have applied in the patient having a headache as such. Silasnate atichiteja ravo anudite pija. Doshasthairya apartham sayad doshotklesham karotja. It should not be applied immediately after taking head bath or in cold conditions or before the sunrise, because it can result in the stability of the doshas and or dosha utklesha, aggravation of dosha could occur. Ajirne api evameva syat sroto margavrodhanat dosha vegodayattam kuryattan sthanupadravanam. In the patients who have ajirna also, anjana should be avoided because it can result in blockade of the srotas and the doshas can aggravate. Tasmat pariharan doshan anjanam sadhu yajet, and hence all these protocols, these care has to be taken. Lekhanasya visheshena kala esha prakriyaha. For the lekhana anjana also, the similar kala, similar time durations are used as such. व्यापदश्चेदेताः सेक आश्चोत्तरलेपनैः यथा स्वं धूमकवलैः नस्यैश्चापि समुत्थिताः. Such of the complications, if they occur, they have to be treated with the seka, ashchotana, or alepa according to dosha, or dhumapana, or kavala nasya. Any of these protocols would be used according to the dosha lakshanas. Vishadam laghu anasravi kriyapata sunirmalam sashanta upadrovam netram viriktam samya abhisheka. After the anjana, lekhana anjana, the eyes should be clear and there should be not too much discharge, and should be capable of seeing properly. It should be active and it should be clear, and there could be no complication. Then we consider that it is a properly done anjana. Dikham dharana durvarnam srastam ruksham ativaja netram virekat yogyasya andate chati matrasha. If there is a lekhana anjana given in excess, it can produce a deviation of the eyes. There could be more pain, the color could be altered, and there could be strain, dryness also could occur. These are the signs of ati yoga. Tatra santarpanam karyam vidhanam cha anilapaham. In such conditions, santarpana kriya with the vatavyadhihara chikitsa has to be done. Akshi mandaviriktam syat ugratarandoshavata. If the lekhananjani is not proper, the disease could be aggravated. In such conditions, dhuma nasya anjane tatra hitam doshavasechanam. The dhuma nasya anjana has to be retried. Sneha varna balopetam prasannam doshavarjitam jayam prasadane samyak upayukto akshinirvrutam. A prasadana anjana would be producing a proper pleasant vision, and the discharges and the color would be healthy. There will be no more diseases produced if the prasadana anjana is used properly. Kinchit dhina vikaram syat tarpanadikrita gati. If tarpana anjana is given in excess, there could be hina vikara, there could be some of the diseases may still pertain as such. Tatra dosharam ruksham bhojanam shasyate mrudo. In such conditions, doshahara and rukshahara has to be avoided, has to be given. Sadharanamapi jnayam ropana rakshanam prasadana bad achaste tasmin yukte adibheshiram. The other signs of excess of the lakshanas would be same as that of the lekhananjana in ropana lakshana also, and the treatment has to be as in case of the prasadana. Snehanam ropanam vapi hina yuktam avarthakam. Either snehana or the ropananjana, if they are given in, if not properly given, then this purpose would not be served. Kartavyam matraya tasmat anjanam siddhimijita. And hence it should be done with the proper dosage and proper protocols. Putabaka kriyagyaso kriyas yeshu kalpana sahasrashta anjaneshu bijena uktena pujitaha. The Putapaka Kriya and Anjana can be innumerable numbers depending upon the dosha conditions. The drugs which could be used could be thousands, and hence whatever is mentioned now is just in the form of a brief. Astau Bhagan Anjanasya Nilotpala Samatpishaha Audumbaram Shatakumbam Raditam Jasamasataha Ekadasha Etan Bhagamstu Yojayet Kushalopishaga Musha Kshiptam Tadadbhatam Abratam Jatavedasi Khadira Ashmantaka Angarehi Goshakradbhi Athapiva Gavam Shakrase Mutre Dadni Sarpishi Makshike Tailam Taila Madhya Vasa Madhya Sarva Gandhodakesha Draksha Rasa Ikshut Tripala Raseshu Suhimesha. Some of the Anjana yogas or Putapaka yogas are the same drugs like Nilotpala or Udumbara. These have to be kept in a golden or silver vessel and has to be are kept in a musha, that the heating vessel, and it should be covered with the soil, and it has to be kept in a flame, and the flame of Khadira Ashmantaka Angara, that heat has to be used in a musha, when the drug is kept in a musha with that Shatakumbha or Rajata vessel, that silver or gold vessel, and it should be heated in that manner, and after that it has to be processed with either Gavam Shakradasa, Gomutra Swarasa, or Mutra Gomutra, or Dathi, or Sarpi, or Makshika, or Tailam, etc. And it has to be used for the Anjana or Ashtotara. Or another prayoga are Sarivadi Kashayeta, Kashayeta, Utpaladike, Nishete, Prasaktinam, Natam Punapunaha. ततो अंतरिक्षे सप्ताहं प्लोतबद्धं स्थितं जले विशोष्य चूर्णयत् मुक्तां स्फटिकं विद्रुमं तथा कालानुसारिवां चापि शुचिः अवाप्य योगतः एतत् चूर्णाञ्जनं श्रेष्ठं निहितं भाजने शुभे दन्त स्फटिक वैदुर्य शङ्खशैलासनोद्भवे शाककुम्भे अतशार्ङ्गे वा राजते वा सुसंस्कृते सहस्रपाकवत् पूजां कृत्वा राज्ञप्रयोजयेत् तेन अन्विताक्षो नृपतिः भवेत् सर्वजनप्रियः अदृश्यः सर्वभूतानां Drishti Roga Vivarjitaha. Another is a Churnanjana, which is for healthy, elite persons like kings or so on. Where the processing is somewhat bit complicated, and it is processed with all the religious conditions, as in case of the Sahasrapaka yoga, where during the Paka you have to have the worships and all protocols have to be followed. And the preparation is Sarivadi Kashaya, Utpaladi Kashaya, they have to be prepared together, and Antariksha Jala has to be kept in, and this has to be processed with the Spatika, Vidruma, Kalan Sariva, etc. And the Anjana has to be stored in Danta, Spatika, Vedurya, Shankha, Shailasana, the different varieties of the vessels. In this, it could be prepared, and it's for a royal families. कुष्ठं चंदनं मेलांशा पत्रं मधुकमंजनं मेषशृंगस्य पुष्पाणि वक्रं रक्तानि सप्तजा उत्पलस्य बृहत्योश्च पद्मस्यापि च केशरं नागपुष्पम् उशीराणि पिप्पली तुत्थमुत्तमं कुक्कुटाण्डकपालानि दार्वीं पथ्यां सरोचनां मरीचानि अक्षमिज्जानं तुल्यां बृहद्गोपिकां कृत्वा सूक्ष्मं तदश्चूर्णैः नसेद् अभ्यर्च्य पूर्ववत् तद् एतद् भद्रोदयं नाम सदैव अर्हति भूमिपः. Another of the Anjana yoga, Bhadrodaya Anjana, where the drugs used are the same, all the drugs are used and kept in the form of a churna. Vakram, Samaricham, Teva, Mamsim, Shailemecha, Tulyamshani, Samanahi, Tehi, Samadresha, Manashila, Patrasya Bhaga, Hataparo, Dugunam, Sarvata Unjanam, Tabache, Esti Madhukam, Puroche, Edal Anjanam. Sarvata Unjana is another of Anjana yoga, where again you will be using Krishna Dravyas like Marija, Jatamamsi, Shail, etc. Then Manashilam, Devakastham, Rajanyo, Trifaloshanam, Laksha, Lashunam, Manjista, Saindava, Elaha, Samakshikaha, Rodham, Savarkam, Churnam, Ayasam, Tamramemacha, Kalan Sadivam, Teva, Kutan, Galanicha, तुल्यानि पैसापिष्टो गुटिकं कारयेद्बुधः कंडु तिम्मिर शुक्लार्म रक्त राजीव प्रशान्तये. Another of the anjana gutika, that varti which can be prepared would be with all the drugs like manashila, devadaru and so on. कांस्या अपमार्जनमसि मधुकं सैन्धवं तथा एरण्डमूलं च समं बृहति अंशद्वयान्वितम् आजेन पैसापिष्ट्वा ताम्रपात्रं प्रलेपेत सप्तकृत्वस्तुतावर्त्यः छायाशुष्काः रुजापः. Another of the varti yoga where bronze vessels residue, that residue which is sticking over the bronze vessel has to be prepared with the madhuka saindava erandamula etc. And this has to be applied over the copper vessel, and from that copper vessel the varti has to be prepared. पथ्या तुत्थक यश्चाह्वैः तुल्यैः मर्चषोडशः पथ्या सर्वविकारेषु वर्ति शीतामुपेशिता. Another of the varti where पथ्या तुत्थक etc. are used. रसक्रिया विधानेन यथोक्त विधिकोविदः पिण्डाजनानि कुर्वीत यथा योगम् अतर्नितः. As in case of the rasakriya, pindanjana also can be used as such. Now that's about what Sushruta has mentioned. In Shargadhara, the Akshit yogas, the kalpas are mentioned as Sekam, Ashchatanam, Pindi, Vidalaha, Karpanam Tata, Putapakam bhi Kalpi Netram Upachareta. Netra Kalpa, there Sharmadhara has mentioned a few more like Pindi, Birala as more than what Sushruta has mentioned. The description of these are Sekastu Sukshmadarabhi Sarvasmin Nayanehitaha Militakshase Mattaryasya Pradeha Chaturungalata. The protocols are standardized in Sharmadhara. For the Seka, the flow of the drug should be as a thin flow, Sukshmadhara, from a 4 angular distance from the eyes. It should be poured from the 4 angular distance from the eyes when the eyes are kept open. Then Unmilite Akshni Dring Madhye Bindubhi Drangularditam Ashchotana Vidishi. Ashchotana is when the same drug is poured over the eye in the middle after keeping the eyes open and in drops form from 2 angular distance. See, these are all the standardizations. Like the flow, the pressure of the flow in case of Seka would be more because it is poured from 4 angular distance in a continuous flow as such. Whereas the Ashchotana is in the form of drops into the middle of the eye. Pindi Kavalika Prokta Badhyate Patavastrikehi Netrabhishyanta Yogasya Vraneshvapi Nibadhyate. Pindi is a kavalika, that's a medicine which is applied or which is covered by a cloth and is kept over the eye, and then the whole bandage is applied so that the drug will be keeping in contact with the eyes, closed eye for a longer duration. Then Biralakaha Bahirlepo Nirte Pakshmavirjitaha Madhada Paradoshine Deshecha Uttanashayanaha Adharo Mashachurnena. That's about the Biralaka, another of the procedure mentioned in Sharmadhara, as an application over the eyes, lepa applied over the eyes without covering the eyebrows or hairs of the eyebrows, and the patient, it has to be kept over that. Then the Putapaka and Tarpana, they are the same as that of what's mentioned in Sushruta. Adharo Mashachurnena Klinena Parimandalo Samudro Asambhado Kartavya Nitrakoshayo Pure Gutamandaila Vilinena Sukhotakahim Athava Shatado Dena Sarpachakshirajanava. That's the Tarpana Yoga, the protocol of Tarpana, exactly as is mentioned in Sushruta. Ata Urdum Pravakshami Putapakas Sadhanam दो बिल्व मात्रों मांसस्य पिंडौ स्निग्धौ सुपेशितो द्रव्याणां बिल्व मात्रं द्रवाणां कुडवो मधः तदेकस्त्वं समालोड्य पत्रैः सुपरिवेशितं गुटिका. That's about the same, exactly almost same as that of Sushruta, no difference there. Then Anjana also, Gutika Rasachurnani Tribhani Anjana. The classification of Anjana also is on the same line as that of Sushruta. Then Kuriya Shalakaya Angudya Hinani Chetotram Putapakena Tat Paktva Griniya Tadrasam Buddha Drishtimadhya Nishetyah Syat Nityam Uttana Shayanaha. The only additional factor is when Anjana has to be applied, Sushruta says, Sharmadhara says it should be in the middle of the eyes that it should be applied. With this, we'll conclude. It is social samhita mudra tantrantrakate Shalakyatantre Kriyakalpo Nama Astadashodhyayah. If there are any questions, we'll try to answer and then wind up. Right, there are no questions, so we'll close